everybody, Dr. Anjana Bhana here, and welcome back to my YouTube channel. Today I'm super excited to be doing my first Sculptra treatment in the practice. We've been through some extensive training and we are fresh off the launch this weekend. So I am so happy to welcome Michelle back here. She's one of our aesthetic veterans and she's an ideal candidate for this treatment. So Sculptra is poly-lactic acid. It's a powder that's mixed into a liquid, and I'll explain the mixing a bit later. But how I've been explaining it to our patients, because they're very familiar with some other brands in South Africa. One of the brands is Aptos, which is a thread made also of poly-lactic acid. So I've been saying it's like liquid injectable threads, but with less pain and less downtime. And then Sculptra has been around for ages. Even though it's only been launched recently in South Africa, it's been around since 1999 and FDA approved in 2004 for lipodystrophy, which is basically facial wasting of the fat in your face. So before it was just for collagen stimulation, for volume restoration, but this isn't a volumizer and this isn't exactly a filler. This is a biostimulator. So besides collagen induction, it stimulates the fibroblasts. So I always think this has like this amazing, powerful and beautiful capability to help your body regenerate itself. So it targets the fibroblast. The fibroblast is the cell that makes collagen, elastin, as well as the extracellular matrix, where one of the things is hyaluronic acid. So besides the volumization, very little volumization, you get lift, you get radiance, you get great skin quality, and you get hydration. So it's an amazing product. They said, you know, ideally for patients over 40. I'm also over 40. It made the entire launch made it seem like people over 40 are falling apart at the seams, but it's not always the case. But as you age, you start losing collagen, you start losing hyaluronic acid, and your skin becomes lax or it starts to sag. So this is an ideal treatment for that. Also, where it's really great is acne scarring and sort of like elasticity issues. So I'm really super excited to start using it. A big part of our our patient cohort has atrophic acne scarring. That's like pitted acne scarring, and we've been seeing some great results from befores and afters with this product. The only thing is, in our world of like immediate gratification, this is a slow burn treatment. This treatment, you'd have to do one procedure, wait 4 to 8 weeks depending on indications. It's an individual thing, but you know the protocol is 4 weeks. Some doctors wait 8 weeks, and then you'd have to do a second, and possibly if you've got loads of scarring or loads of laxity, a third treatment. It lasts and you see a good result up to 25 months, and then after the 25 months your maintenance is just one treatment a year, which is amazing. So and then when do the results become apparent? From 3 months onwards. That's when most of your collagen type 1 is generated. So this is what it looks like. I've mixed it already. So this is 8 ml of sterile water in Sculptra. I shook it for like 2 minutes. It's quite a vigorous shake. You probably see it somewhere in this video. And just before we inject, we add 2 ml of lidocaine. The problem back in the day was hectic nodule formation, and that's because they only mixed it with 3 ml, and that's where all these issues came from. Right now, side effect profile 0.4%, and also very safe related to vascular occlusion. So what we're going to do, we're going to check Michelle out, examine her skin, marker, and then start injecting. Michelle's biggest concern is she feels she's sagging. I think Michelle is beautiful, but yes, she feels that, you know, over the years there's been a bit of laxity. So you can see if we pull Michelle's skin like this, she's a good candidate. So this pull indicates there's a bit of laxity in the skin, and as well as skin quality. So there's some sun damage. The cool thing with Sculptra is it's an amazing combination treatment. So with Sculptra, you can also do skin boosters, and we've done some fillers for Michelle as well. So you can also do some fillers, RF microneedling, normal microneedling. So a Sculptra cannot be injected in the middle of the face. So these areas here are not for Sculptra, but you can do skin boosters to improve the skin condition as well as laxity there. And another place Sculptra cannot be injected, or else it'll make little nodules or little balls in the skin, is around the mouth and around the eye. So those muscles, like if you tense your muscles, they're super active and they kind of squish the Sculptra. So Sculptra is a whole lot of these little particles called poly-lactic acid, and then what happens in a nutshell is they are deposited, and your white blood cells along with growth factors hook onto them, and they cause a controlled inflammatory response. And this controlled inflammatory response makes your body kind of think it's injured, and then it starts to fix itself by producing collagen, elastin, and all those good things. And Sculptra, generally, if you turn to the side, Michelle, is generally injected in the lateral area. So up into the temples. It can also be injected into the hairline to give a lift, as well as these folds here. So what Michelle's concern is this, as well as this. So we're going to just concentrate on these two spaces here. So I'm going to mark up Michelle, and then we're going to start injecting. Okay, Michelle, you can sit back for me. Okay. So we're going to mark, and the important thing is, if you smile, Michelle, please smile. So I am marking here so we don't get this muscle called orbicularis oculi. I wouldn't call it a sphincter muscle, it's almost like a sling, but it makes like a scrunchy sort of motion. So we don't want any of the Sculptra getting into that muscle. And we mark out the temple. It's a nice safe treatment for temple, and often patients forget, or us as well, doctors forget the temple, and it's very aging, especially on a woman, to have those hollowed out temples. And you know, there was a time where we just fill cheeks, and then people look like these huge maleficent creatures, and then they have like a hollow temple. Michelle. But you don't look like that, Michelle. No, not at all. Yeah, you're. Yes, Michelle's really good on TikTok. So if you, what is your TikTok handle, Michelle? Mish Wellness. Mish Wellness. So if you can go check out Michelle on TikTok, she's very good at it. I have to improve my TikTok skills. Okay. And then you see here, there's a bit of like laxity there. So we don't want to put too much Sculptra there, because I don't want to get it like too much into the mid face and bulk up, but I'll put a little bit, like a couple of strands there, just for skin quality as well. So there we go. So we want to avoid this orbicularis. And then it's 5 mils per side. So usually the temple takes the most. And then in the next session, you might need only 1 mil in the temple, and then we can concentrate the rest there. And if you relax, Michelle, so we want to pull up there. And then this like sort of skin laxity there. So smile for me again. There's a bit of, you know, elasticity issues, but I don't want to bulk up that area or put too much there. So I'll probably put, like, as I said, 3 strands if you completely relax, Michelle, like that. There we go. And Sculptra is actually quite a workout. So shaking that thing for like 2 minutes will give you some biceps, and then afterwards you'll see the massage. The massage is like a 5-minute ordeal of me massaging. So it's quite an intense treatment, but comfortable, very comfortable. Here you see there's this foam at the top, and then the rest is what we draw up. So we shouldn't draw up the foam. So I'm going to draw up 2 separate 5 ml syringes, and then we're going to start injecting Michelle, but with a cannula. Well, actually, you know, Michelle was asking now, will it do anything to a filler? It won't do anything bad to your filler. It's actually a complementary treatment. So they've got something in Brazil called Firm and Lift, as well as Refresh and Lift. So Refresh and Firm. So Refresh and Firm is using the skin booster with the Sculptra, because like I was saying, you know, you can use the skin booster basically medially in the middle of the face, while Sculptra you'd have to use in the lateral face, and then the firming would be the HA filler in the middle, you know, augmenting your cheeks, your lips, your chin. So, you know, you can't put Sculptra in the chin. But interestingly, if you go find the hashtag Sculptra butt lift, you can put it in your butt, but that's like a very expensive butt. I mean, you need 40 vials of the stuff. And I think it's just not viable, especially for the South African market. It's very popular in the States, but yeah, they use it to get around butt. I would say, you know, in terms of like butt lifts and things like that, I would rather see a properly qualified plastic and reconstructive surgeon who loves body work and would do like a BBL, like fat transfer, but that's also a very high risk procedure. So you have to be really careful when you do that. I mean, I've seen some really nice results with the Sculptra, but I think it's just prohibitive cost-wise, because yeah, 40 vials of this stuff for our market is just not. I don't know, there maybe people would want to do it, but I can't see it. There we go, we're getting all the Sculptra out. Come on, Sculptra. So yes, like they were saying at our workshop, it is a struggle to get all 10 mils out. That's why you actually mix a bit of extra liquid when you're doing the sterile water and the lidocaine as well. So we're ready for you, Michelle. Even though it's not a topic for discussion at the moment. So we just did face, but Sculptra can be used in the neck as well as the hands. That would be excellent. And I asked one of the doctors, because I've seen it, you know, combined with PRP, PRF, is it really something that is necessary? And she says no, because this is a form of regenerative medicine. So it's putting something in that already stimulates your body, your growth factors, to start basically like your dermis to start fixing itself. So it's really amazing. Okay, Michelle, I'm just going to. Okay, I've already disinfected Michelle, but I liked spraying a little bit of hypochlorous acid just for a bit of extra disinfection, and then also getting into the hairline, because we often deposit Sculptra right up here to give a lift, so behind all these ligaments. There we go. All right. So what I've discovered is the thing with Sculptra is planning your treatment so you get the best treatment outcomes. Michelle, are you feeling okay? Mm-hmm. Would you like one of these distraction devices? Do you want to? Do you feel like you need it?
No, I'm fine.
Okay, that's fine. So I discovered that one of the most important things in terms of Sculptra is pre-treatment planning and having the correct patient, because yes, this is an amazing product, but it's also a non-surgical means, and sometimes in certain patients doing a surgical procedure might be, you know, give you a better outcome. But also, the cool thing is you can use this to enhance your surgical procedure. So it's important, if you are planning to and you're not adverse to facelifts and things like that, to do that first, because if you do Sculptra first, it may make the surgery more challenging, because it creates a lot of collagen. So when the surgeon has to dissect, there's like lots of these adhesions. So yeah, you okay there, Michelle? We're in the subcutaneous tissue, so because of that, it is comfortable. You may feel pressure. That's what most people may feel. And I like going slowly, so it requires less swelling. And the thing with Sculptra is, and I'll explain the massage, but no anti-inflammatories, because the whole point of this is to create a controlled inflammation, and the anti-inflammatory drugs will like affect your result. like this rush of these particles, and then we massage, and then we kind of spread the particles apart, and the particles become like a node of regeneration. They become like a nucleus of regenerative power, and then all these white blood cells get stuck onto it, and it makes like a giant cell, they call it, and then it calls all these growth factors, and then makes these fibroblasts, and the fibroblasts start like shooting out collagen and elastin, and that's what like the lift is, and that takes like about 3 months, but then it continually improves, and most patients, like satisfaction wise, up to 25 months. I know it goes probably beyond that, and then maintenance after those 25 months would be once after. Okay, so then the other cool thing is, and we've had like a really big focus on male aesthetics, males, I was going to say male aesthetics, but or male people, men, men love this treatment because, you know, I think the fear is looking too feminized, looking unnatural. So when you do this treatment, you actually don't look any different, you know, you look like yourself, and the gradual change and helps with this like skin laxity. Also patients of color, like we've said before, have loads of fibroblasts, more fibroblasts, nice thick skin, so they respond really well. And in our practice we also see a lot of Indian patients with acne scarring, atrophic acne scarring or pitted acne scarring, so I'm quite excited to combine that with our other treatment modalities, because they also have like good quality skin, thick skin, lots of fibroblasts, so I think some really nice results from this. Sorry, you okay, Michelle? Sorry, I know this part's a little bit. This will be nice for these little ear wrinkles. You know, Michelle, I'm just going to mention, prior to having this done, you had a Fontana laser treatment. So that also should build collagen, but sometimes, you know, we need like fertilizer. So sometimes doing very aggressive treatments very close together can be detrimental to skin, whether you've got light skin, dark skin, Fitzpatrick 1 or 6, and it's nice to replenish your skin. So you can think of this, yes, as a replenishment and helping, you know, yes, fertilize the skin. So when you do another aggressive treatment, and I know what your next aggressive one is going to be, it's going to be an ND med with us, but we'd like to restructure, feed the skin, get it to a place where when we do something intensely regenerative like that, it's primed to start healing and healing well. Okay. And then I'm going to do the other side. Okay, so the other important part of this treatment is actually the post-treatment. It is very important to prevent any issues such as nodules, which is operator and patient dependent. The other issue that can happen would be granulomas, but that is also patient dependent, but more like the immune reaction of the patient. If you've got autoimmune diseases, or you don't react well to vaccines. So that's a rare possibility, but this massage is almost as important as the actual Sculptra going in. So the important thing about the massage is, and I'm not the best, but I'll try, Michelle, is to move the product laterally to the back. So, you know, where we've injected to the back, so up and back, like so, like this. So the patient has to do this at home for 5 days, 5 times a day, for at least 5 minutes each time they do it. So 5, 5, 5. And what this does is all those little poly-lactic particles, it spreads them, it moves them apart from each other, and that creates these nodes of regeneration. And the further apart, the better. Michelle is very much into fitness. She trains people on wellness, and you're an NLP coach, eh? So she was asking about exercise, at least 48 hours without exercise, and no anti-inflammatories after this treatment. It may be tender like tomorrow and the day after when you massage, but nothing that you'd need like a medication for. And no ice, don't ice the area. So yeah, it's just this. So if you're at home as a patient, you can also perhaps use, a lot of people have these gua shas, especially if your hands may get tired. So to move the Sculptra and massage it more laterally. It's a nice tool to use, or you can just use your hands. Just make sure it's clean before use. You can use alcohol to wipe it. I just used some HOCl. As you can see, we're at the end of our first Sculptra treatment with Michelle, and she's smiling. So it's actually a really nice, comfortable treatment, and not much downtime really. Michelle might have a tiny bruise, that's possible every time you do an injectable treatment, but it should go without any hitches. Michelle knows exactly what to do post-treatment, and she is very disciplined, so I know she'll do what she needs to do at home, because that's really important. What you're doing at home is really, really important. And if you guys have any questions, I'd love to hear them. Drop them in the comments down below. Like, share, and subscribe. Bye.